I'm just continuing on with that concept of bruxism Malin-Party and what we need to look for. So Val has a very deep overbite, and we've made her a dorsal air appliance. And the dorsal air appliance, can you bring your jaw forward to where you are with the appliance in place? Is here. And if you have a look at the wear facets. The wear facets match the anatomy of the teeth perfectly. So that is what a patient's trying to do at night to keep their jaw forward and keep their airway open. Val, if you just open for me for 1 second and just say ah. Can you see the Malin-Party? It's a Malin-Party of 4 because the soft palate basically is forming a seal with the tongue. We don't really have much of an opening of the oropharynx. So when you see that as a Malin-Party, just bite together again for me. Normally, yeah. When you see a deep bite like this, trapping the mandible. When you see, open again for me, wear facets limited really to the anterior teeth, and you can see that. Then those wear facets, if they match the upper, can I get you to bite forward again, please, Val? Yeah, there, look at that. That is all the dead giveaways of sleep apnea. So we looked at this and we were able to figure out that Val had actually an apneic index of 15.6. And just with the appliance in her mouth, that index is reduced back to 5. So that's been a very, very good outcome. So if you're giving someone just a flat plane splint, and you're wondering why they're still grinding through it, it means that the cause of their grinding is not stress-related. It's what we call sleep bruxism. And I'm happy to send an article by Dr. Gilles Levine on that concept, but it's got to be diagnosed by a correct sleep study that has masseter leads for EMG, that also will have an indication of when the apneic event is occurring, and you see if you can link the two. But the main thing that we're looking at is the obvious signs of wear in a deep overclosed bite with Malin-Party, with scalloping of the tongue. And all of these are something that you should pick up. Now, if you make a splint, a conventional one, not a repositioning one, it could actually worsen the apnea. So dentists are thinking they're reducing the bruxism, they're actually not. So that's something that we need to look at with these wear facets.